Hi, Dr. Diane, your libido doc here. We're talking today about pain in the vulva known as vulvodynia. This is a very common condition. It is said that about 16% of women will actually experience this at points in their life. And so many times there's not a lot that is really given to people to help them. So oftentimes when vulvodynia types of symptoms start, people will go, they'll get tested for STIs, they'll get pap smears. So if infections are normal and pap smears are normal, sometimes women are told there's nothing that can be done. So we have to understand, why does this happen to begin with? Because this is very impactful, right? This is a reason for low libido. This is a reason for disconnection between a partner, between oneself. This is a reason that we can lead to other pelvic health and pelvic floor problems, because when it hurts, when our vulva hurts, nothing feels good. And when we are trying to then avoid sex and avoid intimacy, then we are not using the muscles of our pelvic floor correctly, and that can lead to subsequent problems in those areas. So what really causes this, right? What is the root cause of vulvodynia? So one of the biggest things is there is a genetic predisposing factor to this. So that's number one. But of course, we're not destiny to our genes, right? So we see in research that most of the time there's some sort of adverse childhood event that is also present in women with vulvar pain. Now, this could be something as serious as a sexual trauma, but now we know in the adverse childhood events research that sometimes this is just as simple as something a teacher said to us, something a parent said to us that was fairly benign in nature, but the childhood mind interprets it differently. And the child mind might have been really impacted and affected by something that didn't bear the meaning that we thought it did as a child, and therefore can act like a more serious trauma. So we typically see that there's that genetics, there is that predisposing adverse childhood event on a wide scale of what that could actually mean. And then third, we see that people have a predisposing factor, that there's something that triggers this. Now, this could be something like an infection. It could be something like inflammation of the nerves that go to the vulva. So these are nerves such as the pudendal nerve, the vagal nerve, other nerves of the pelvic floor, right? So we have several nerve roots, several nerve branches that are actually feeding nervous system control to the clitoris, to the labia, to other areas of the vagina, the cervix. And so all of these areas could be impacted due to neurological inflammation, right? We can see that things like peripheral neuropathy. So we talk about peripheral neuropathy, we have numbness and tingling in our extremities that can happen with things like metabolic disorders like blood sugar. Well, our vulva is considered part of our periphery, right? So these endpoints of these nerves, and when we have things like metabolic disorders, blood sugar disorders, that can create problems as well. We even see links in the gut microbiome, the good guys of the gut. Some research is actually showing that the gut microbiome can serve almost as like a reservoir for the vaginal microbiome. The vaginal microbiome is supposed to be very acidic, and it is the bacteria of the vagina, especially lactobacillus, that actually create this acidity in the vaginal tract. And the gut can almost serve as a reservoir. So if, say, running out of these microorganisms in the vulva vaginal areas, that we can actually transfer these from the gut. And so if there's gut problems, right, if we have gut inflammation, irritable bowel syndrome, irritable bowel disease, constipation, diarrhea, bloating, etc. in the gut, that can lead to microorganisms not reserving, not holding as that backup reserve, which can lead to pH imbalances vaginally. And that can actually lead to components of this vulvodynia picture. So the thing I always like people to know about vulvodynia is like, yes, there is this genetic predisposition. Yes, we absolutely want to work on healing any of those adverse childhood traumas, working with a psychologist, figuring out what those core beliefs and emotions that have emerged from that and reversing those. And we really want to get to the root cause of the disease in these other areas as well. So I hope that's been helpful. Please do leave your questions and your comments. Please do subscribe. It does help me spread the word with this kind of stuff to more people. Vulvodynia is such a common problem. I hear about it all the time. And so many people are just told there is nothing that can be done, and there are actual solutions. So we'll talk more in another video. I'll see you then. Thank you for your subscribing and for your support.